And welcome to the John Baldwin Show, and at the risk of sounding redundant, I am John Baldwin. Tonight we're going to be talking about chiropractic care, what it is, what benefit it has, clearing up some of the misconceptions folks may have about it. And to sort all this out, I have with us the expert, my chiropractor and good friend, Dr. Moses Moretti. And I can tell you he has helped me out not only with his care, but also has educated me about the human body and how it works. So no pressure or anything. Well, welcome to the show.
Well, thank you, John. It's a pleasure to be on the show, and it's been a pleasure caring for you, and I'm glad that I had the opportunity to speak to you tonight, and it was an honor that you asked me. So I'm hoping that I can help shed some light on those things and be helpful to patients or people who are thinking about maybe seeking out a chiropractor in the future.
Exactly. Well, tell us a little bit about yourself and your practice.
Well, my name is Dr. Moses Moretti, and I have been adjusting and caring for families for over 15 years. Currently, I'm in practice in Moretti, Virginia, Troutville, technically, but we have a family practice that focuses on teaching and educating a holistic lifestyle, caring for kids and families of all ages. And I'm thrilled to be practicing here in Virginia. My wife grew up in Virginia, and it's felt like home to me for the last almost 10 years now that we've been here practicing at this location.
And what inspired you to go into chiropractic care?
Well, I have to give most of the credit to my father, who ran a natural food store in Connecticut. And for over 30 years, I'd see him, as a kid, go in and see him talking health and wellness to the customers. And it was always something that was a big part of my life growing up. I received my first chiropractic adjustment when I was 2. And then my chiropractor for many years of my life became such a close personal friend that he was the best man in my wedding. And so I give most of the credit to the influence from my father and being raised in a health food, holistic family, and also my chiropractor, who was such a big influence as well. They were both really important and still are important to me.
What education is involved in becoming a certified chiropractor?
Well, the Doctor of Chiropractic degree is achieved once you've completed your undergrad requirements and then go on to a chiropractic school, and it's a 4-year doctorate, similar to a 4-year medical doctorate, but you are focusing when you're in school on different aspects of healthcare. So it is then required after you complete the program, the chiropractic education, that you take state and national boards, and there are 4 parts to your boards, and when you've accomplished that, then you can practice legally in the state that you choose. So it's a lot of work, but it was worth it. I love everything about practice, and it feels like yesterday, but when I was in it, it seemed like it was never going to end. It's a lot of schooling.
I'm sure a lot of doctors would say the same thing too.
Absolutely. And I get asked, I have families I work with that sometimes there's a student that's curious about going into school. When I tell them the level of education and the amount of time you spend, hour to hour, it's the same as a medical doctor, a DO, a physical therapist, and it sometimes scares them, the amount of schooling, but it is so worth it and goes by quickly, really. So very grateful to have done that.
And what are the main differences between chiropractic care and traditional medicine?
Like I was mentioning, the schooling is similar, but there is a very different focus. In chiropractic school, we learn and spend a lot of time studying anatomy and physiology and the basic sciences, and we have the same textbooks that you would use in a medical school for those subjects, the same radiology textbooks, the same anatomy textbooks, and we spend the same time, in some cases even more time, studying the function of the body, the way the body is working. But at some point then our focus is on proving the function with the chiropractic adjustment, which we'll, I'm sure, talk about more in this conversation. where a medical doctor will focus on pathology and diagnosis and treatment of symptoms. And that is their main focus. The chiropractic profession is focused on, and a chiropractic adjustment on, improving function by removing interference to the central nervous system. And that is the intent of a chiropractic adjustment, where a medical doctor will spend time diagnosing and determining a label for a condition, and then treatment of that condition based on the symptoms the patient is having and how a certain pharmaceutical or medicine can affect the physiology of the body, where chiropractic care is solely focused on improving function through improved nerve health.
Yeah, you're getting to the root cause, not just the symptoms.
That's a great way to summarize that. And in most cases, working and caring for families for over 15 years, if you've not been under chiropractic care, often the root cause of a lot of health concerns that people have is nerve interference, because your nervous system, the central nervous system, is the control system of all aspects of health and function in the body.
How are the immune system and the nerve system related to one another?
You know, I have seen in my practice the benefits to the patients I've worked with repeatedly over the course of my career, and one of the biggest impacts on their health is how their body handles the stress and the interaction with their environments. And when we look at chiropractic adjusting and we look at the connection between the nervous system and the immune system, we can understand why that impact is so prevalent within the profession. If I were to describe the intimacy between the nervous system and the immune system, I would have to accurately talk about those two systems as one and the same. They're so intertwined in their function and in their application in the body that when we affect or improve the health of the nervous system, we are directly affecting or improving the health of the immune response. So although as a chiropractor I'm not treating specific immune reactions or bacterial or viral responses, you know, like your common cold or flu symptoms or how the body interacts with its environment, I'm able to help support normal function and health by improving nerve system function.
I was guilty of this too many years ago. There are a lot of myths out there, or misunderstandings that people have about chiropractors. What are some of those, and how can you ease people's mind about it?
Absolutely. Some of the concerns that I hear or the misunderstandings I hear, and I've heard, I think, every single one over, again, the course of, I've been adjusted and been seeing a chiropractor for my whole life, so I'm familiar with most of the concerns. It's not often now that I don't hear something new, or that I hear something new, rather. But one of the big things I hear frequently is that if you start getting adjusted, you'll have to keep getting adjusted. That it's the kind of thing that you once you start, you have to keep doing. Well, I can promise you that we don't force anyone to get adjusted in my office. There are no bars on the windows. I joke with patients that are concerned about that at any time they choose to stop receiving chiropractic care, that it is certainly their decision. But I also ask them the question that, frames that differently. If you were to start, eating healthy and seeing the benefits of that, or exercising regularly and seeing the benefits of that, or let's say, you never took care of your teeth and then you started seeing a dentist and caring for your teeth really well, it would be your choice whether you continued to do those things, but why wouldn't you want to? And so chiropractic care is very similar in that the patients that I have seen for years and years and years, and patients who utilize chiropractic care as a lifestyle choice, understand how important it is and how beneficial it is to their health, so they choose to continue. One of the other big concerns is the safety concern, and I've heard concerns regarding safety of adjusting the spine before. And with all healthcare, there is a certain level of risk involved. Anytime we are administering any type of healthcare at any level, there is a risk. But my way of explaining or alleviating that concern with patients is to share with them the simple fact that my car insurance for my two vehicles, my wife's vehicle and my vehicle, is more than my malpractice insurance for a year. And I have excellent malpractice insurance. And if you know anything about insurance companies, they're concerned with bottom dollar. And chiropractic as a profession, we hurt and injure very, very few people. It is very unlikely, if you're seeing a very thorough chiropractor who is very skilled at what they're doing, that there's any injury or negative outcome from that adjustment. Is there a possibility of that with an unskilled or a chiropractor that isn't thorough before they adjust? Absolutely, but that's the same with all healthcare. It's the quality of the practitioner and the inherent risk of the type of healthcare. And since we have such a low inherent risk with chiropractic, if you find a great practitioner, you're very unlikely to be injured. And those are two of the biggest concerns I hear.
And this might be a good point to ask this question, because I know there are different types of chiropractic care. I've been to different ones. I mean, there are some that, for the lack of a better term, it's like you're being bent in a pretzel and they're pushing in on your back, whereas I think your method is a little bit different. Kind of tell folks how you approach an adjustment.
Absolutely. There are many different techniques or ways of adjusting the spine, and depending on, again, the focus of the practice, you might find an office or a chiropractor who focuses on and adjusts many athletes, and so the technique will be geared towards adjusting sport injury and sport-related misalignment. The misalignment in the spine that a chiropractor corrects is called a vertebral subluxation, and depending on the technique that is used, we can correct that subluxation in many different ways. The technique I use is called the Thompson technique. I also use two other techniques, an upper cervical specific technique and the activator. And those three together form the focus or the way in which I adjust the spine. They are concerned with very specific adjusting and very high velocity, so very quick. Now, that's different than an adjustment where it might not be as specific, but the force used is a little greater, and it can be uncomfortable to some patients, and it can be preferred by some patients. But I prefer being adjusted with the Thompson technique, which utilizes a table as an assistant, and the table moves underneath the patient in a way to make the adjustment easier on both the patient and the doctor. And it's also a very good technique if you're going to adjust. In my practice, the focus is on family care and working with kids and patients of all ages, and you can modify the technique according to the age and to the weight and size of the patient. And that's where those techniques really have an advantage.
Well, I know a lot of times you're adjusting me, and it actually feels good. I'm like, ooh, that felt good, right where you adjusted. So.
I'm glad you said that. I love to get adjusted. I see my chiropractor regularly and look forward to it every time I'm there. And that's if someone says to me, I've tried chiropractic, I didn't like the way they adjusted me or the technique they used wasn't a good fit, I encourage them to find another, similar to how you might not like someone's, a dentist's bedside manner or approach, and then you find one that you fit with well. It's my hope that everyone seeks out the right fit for them with their chiropractor.
All right. Kind of give us an overview of the human spinal system and how it benefits from regular chiropractor visits.
Sure. Well, there's 24 movable vertebrae in the spine, and this is the vast majority of people. There are, in some cases, 25. There's variants to that, but most people have 24 movable vertebrae, and your spinal cord, which is your lifeline, travels through the spinal column, your vertebrae, your spinal backbones. And when we look at the nervous system as one system within the body, it could be best described as the master control system. It is your central nervous system, so your spinal cord, your brain, are responsible for communicating both function and healing messages to the entire body. And when we are adjusting the spine, we're affecting the quality of that communication, of how strong and healthy that nerve communication is. And regularly caring for that system is akin to, say, caring for a finely tuned piano music is going to be affected by the lack of care or maintenance. And a very high-end piano needs regular adjustments and fine tuning to perform and play and sound the way that it should, which is at the very highest level. And we have bodies, and physical expression of health can perform and have that kind of expression of health when cared for as well. So I think people are often unaware of the complexity of what's going on under the surface, and the human body is a marvel of engineering.
It is that. It is that. Well, when you start seeing a patient, what is your general goal for that person?
Well, it really is the same for almost everyone I work with. I am hoping to find out what their goals are. So my general goals kind of go aside, on the side to begin with. I want to make sure that we're understanding what their health goals are, so that if chiropractic care can be a part of them achieving that goal, I can feel confident taking on that case and working with them. If their goal is to just be pain-free in the shortest amount of time, well, often a pharmaceutical, chemical, so a medicine or a drug or a steroidal injection or a therapy is going to give a quicker short-term result. So if their goal, though, is to get to the underlying cause of loss of health or dysfunction, and we can work together over a period of time, then our goals, the patient goal and my goal, will align well, and then I can take that patient on as a patient, or that family on. And if we are first on the same page, or those goals are aligning well, then I look to accomplish really one simple goal: improved health through less stress to their nervous system. And as I adjust them, we see many areas of health improve often, but the goal every time they come into the visit, or to the office rather, to get adjusted, is to find and correct the vertebral subluxation, the condition, again, where the bone is slightly out of place, causing nerve interference. And as we go through that process of training the spine and training the nervous system and training the muscles to be healthier, we see that their body's overall health improves, and that's how they reach their health goals. If the goal is to, have less pain, or to be sleeping better, or have overall more energy, these are common goals in the office. We see that is accomplished as a byproduct of improved nerve function. So my goal is always to make sure, though, that they get an expert chiropractic adjustment every time they come into the office.
So how does chiropractic care benefit one's life in general?
Well, I've thought about that a lot over the course of my career. I've really found the words that I think answer that question best in the course of seeing and watching patients experience life differently under care, and whether it's a physical health improvement, a emotional breakthrough, they've been under care and decide to take on their diet goals. The best way that I can explain that is that when you think about your experience of life, you should be aware that your nervous system is what you experience life through. Everything you experience is filtered and intimately connected to your nervous system. The conversation we're having, our brain is processing the sounds and making sense of and creating words based on those sound waves. The sensations on the chair that I'm sitting on are being evaluated by my brain so that it knows that I'm sitting, and there's pressure involved in that. We intimately experience our life through our nervous system. And so when we're adjusted and our bodies are under less stress and our nervous system is under less stress, it affects our experience of life. And how that is experienced on an individual basis is very intimate. Some people will find that they are able to focus better, or that they're able to maintain a conversation better. I've had patients share with me that they, over time, with regular adjustments, because their nervous system is under less stress, are less likely to get angry quickly. They're able to maintain composure with their emotions better. They have a better relationship with their friends and family because of, again, the the reduction of stress to the system that they experience life through. And that's a lot different than what, people might generally think about an adjustment. They often will focus on the area that I'm touching of the body, which is the spine. But the spine is my way of interacting with the nervous system through a series of levers. And every time I adjust someone, I think about the effect on the nervous system in that area of the spine I'm adjusting.
And, of course, now you do the adjusting. There are some things that the patients have to do when they're not there with you in the office. So what advice do you give to your patients so they can aid in their own healing and wellness process after you've adjusted them?
Yeah, that's a great question because I am regularly reminding people that it's a team effort. I could adjust someone regularly, and if they're going to eat fast food and not exercise and stay up all night every night, they're not taking enough responsibility for their role in their health outside of the office. So those are three areas right there. But certainly, being conscious of sleep and the importance of sleep and diet and the importance of diet and making sure we move our body regularly. Exercise is a vital part of normal health. We hear that statement all the time, but I think it is underappreciated. I can't find an area of health within the body that isn't negatively affected by loss of normal motion over time. So let me put that in another way. If you slow down normal motion within the blood flow, or slow down normal motion within your digestive system, or slow down normal motion or communication within your nervous system, or the muscular system, or cardiovascular system, if you reduce normal motion and really limit the normal motion activity of that system over a long period of time, we lose function and health. So exercise and movement is such a vital part of life, and yet, even though we know that and it's something most people are aware of, there's still people not moving daily or regularly and moving enough. So I teach in the office approach of teamwork so that the patient and myself are working together to achieve optimal health for their during their chiropractic experience. I teach workshops, so we do talks in the office that they can participate in and learn more about the specific areas of eating healthy and exercise. And then they're armed with the information, but ultimately it's up to the individual to take responsibility and be proactive. If I want to explain that to a patient, I tell them that if they've hired the best personal trainer to the stars and want to get in great shape, but don't go to the gym, doesn't make any difference. Great an adjustment or an amazing chiropractic experience that they have, if they don't come in and get adjusted and follow some of these other recommendations, it's going to affect the results.
Well, you brought up something. I was going to ask this question later. Okay, so somebody out there might be listening and says, is it okay to occasionally indulge in foods like a pizza?
Yeah, no, you have to absolutely live like a robot and cannot eat those foods. Of course, I'm kidding. It's a common concern because I think when people are making a health choice or considering changing a health habit or making a lifestyle change, I think a fear is that they're going to not be able to enjoy things that they already enjoy, that they're never going to be able to have pizza, or if they're going to change diet and eat healthier, they're afraid of missing out on those things. And I recommend an 80-20 approach where 80% of the time you're doing the really healthy stuff, so eating healthy food and getting enough motion, getting good sleep, and then 20% of the time, so occasionally, if you want to have unhealthy foods, and certainly I go out with my family, and if we're out in Roanoke and downtown and we're eating unhealthy, patients know that that's okay because we're human, we're not robots, and sometimes we should indulge and have those things. The problem comes about when people do it the other way around. So they eat really unhealthy 80% of the time, and then once in a while they have a salad and they think, what's wrong? That's the reverse of what I'm describing, and what most people, fortunately, are doing when it comes to their health. They have created a lot of bad habits over time by not maintaining that percentage where it's just an occasional occurrence, not a regular habit. How
does getting an adjustment when you're sick help?
Well, when you are in an active immune response, so we talk about in office, instead of, what most people will call sick, a common cold or a fever or virus reaction, is what is described in our office and how I talk to patients about that as a healing response, because at that stage, when the body is using the symptoms of a common cold, for instance, congestion, maybe a mild fever, a reaction of cough or sneeze, those are examples of the immune system using the symptoms as a way of restoring balance. If you cough, you're clearing congestion from your lung fields. If you are having a fever response, your body's using that tool to restore balance. And so when you get adjusted, the adjustment doesn't treat the specific viral or immune system challenge, bacterial, viral, whatever the sickness, quote unquote, is not being treated by the adjustment, but it helps strengthen the immune response, because back to the question about the connection between the immune system and the nervous system, there is such an intimate connection that when I adjust the spine and I remove nerve interference, we help your body heal and restore function better, because we are intimately affecting the health of the nervous system. And that's when I encourage patients, when they're having the signs of a cold, or they're having congestion, or they're going through the common ailments that a lot of patients and families go through, is to get in and get adjusted as soon as possible, so we can help support the return to normal function, which is what the body wants. We're just going to be there to assist in any way we can.
I've found that particularly in the winter times when I get colds, they're not nearly as bad or severe as they used to be before I started coming and getting adjusted. So I definitely made a believer out of me. And believe me, I used to get colds where the cough would hang on for a month. And knock on wood,
I've seen that change, John, in the time we've worked together. I keep track of and will write down with all patients their concerns with their health, and it's been great to witness. I'm privileged that I've seen that over 15 plus years with the families and the patients I work with consistently, and it's in the profession as a whole. We've done tremendous research. I have on my desk right now a 250-page research compilation, so it's many different research projects compiled into one resource that is solely looking at the interaction between the nervous system, the immune system, and chiropractic adjustments. And it took me a while because it's dense material to read, but reading all through that, we have a lot of evidence to show how important it is to our nervous system, and how important it is to our immune system to get adjusted and to regularly care for the spine and the nervous system. It's one of those things that I run into where if you ask patients, what's the best way to care for your cardiovascular system, or the best way to care for your teeth, or how could you best care for your digestive health, most people have answers for those questions. But then if you ask them, what's the best way to care for your nervous system, there usually is not a lot of clarity, unless they're under chiropractic care and have been taught that the chiropractic adjustment is the best way to care for the nervous system. And since our nervous system controls all function in the body, it should be at the top of our priority list in terms of regular health maintenance or regular health concerns. And that's why I see patients like yourself who, have a history of colds and viruses and infections improve so dramatically over time. It doesn't happen right away. The body learns based on repetition. And so it takes time to retrain the way the body's responding to its environment and to its stressors. But once we create momentum and strength within the nervous system, we can see a tremendous turnaround in someone's health.
Yeah. And I'm John Baldwin. You're listening to the John Baldwin Show and talking to Dr. Moses Moretti, and certified chiropractor. And Tell us where folks can find you online and contact you to make an appointment if they so desire.
Well, the website is probably the best way to do that. You can get online and look up chiropractic.com. And our phone number, our contact info, our address, the website has a way in which you can email directly to the office with any questions or concerns or anything. Really, just if you wanted to reach out to us through that, you can. And then also on Facebook, there's a large presence. We have a presence on Facebook as well. I don't use Facebook personally, but my staff and my wife are really active on there. But the MorettiChiropractic.com is the easiest way, and certainly our phone number is on there as well.
Well, we've been talking about adults. Let's talk a little bit about children and how chiropractic helps them.
Yeah, it's actually a really big focus in our practice. I have advanced certification and specialty with working with pediatric care and maternity care. I've spent well over 200 hours of continuing ed time focusing on becoming an expert at adjusting infants and kids, and it is a priority to me to teach families the importance of that. We make it a point to work with with many pregnant moms through the pregnancy and then postpartum, check their spines, and then check the infants after they're born. And kids have spines and nervous systems and have many health challenges as their immune system and nervous system is developing. And we would want their nervous system to be free of any interference and any subluxation affecting that development. And the best way to do that is to get adjusted.
Yep. What about, somebody might be listening, what about animals? Can animals benefit from chiropractic care?
Yeah, no, that's a great question. And our chiropractors who specialize in adjusting animals. I know of practices that have whole days put aside for just animal visits where patients will bring in and travel from distances to have all different kinds of animals adjusted with techniques specific and ways of adjusting specific to the animal. And that's an area of specialty within the profession, similar to how pediatric and maternity care and working with infants and pregnant moms is a specialty that I have. It's never something that I've pursued, and I don't personally adjust animals in my office, but I have other families who regularly take their horses and other animals to chiropractors that I can refer people to if they need that.
Cool. Now, one of the neat things about your office, you often have flyers in there that talk about different areas of the body, and one of the flyers you had in the past talked about backpacks that most kids tote around these days. How is that harmful to the spine and the neck?
Well, any time we do an imbalanced stress or a repetitive micro stress, so something to our body repeatedly over time, and kids carry backpacks. My daughter has just finished kindergarten and is headed into first grade, and the number of things that she puts into that backpack weigh it down to the point where she's carrying around potentially a very heavy weight, and her spine and nervous system are still developing, so that repetitive stress over time can lead to dysfunction. I have a flyer like you mentioned that we give to the local schools so that they can put in their first day folders for families to learn about how to have the backpack weight be appropriate for the child's weight and how to fit it properly for the child. And that's an example of repetitive stress. There are many areas of repetitive stress in most people's daily routines. So if we can eliminate the ones we can either reduce or eliminate, your body will benefit from that because it will be less stressed overall. And especially with kids as they're developing, we want to make sure that their backpacks are fitting well and are not overly heavy. I know we have to keep an eye on that with our daughter, and it's something I talk to the parents about in the office.
I remember when I was in school, we didn't have backpacks. We just had to carry them in our hands. Boy, that was tough sometimes.
Yeah, I know. Yeah, now they give so many different books and teaching guides, and they have the lunch boxes and all of those things in there, I mean, it really adds up over time.
Yeah. And another interesting area which I've been educated on is that most men carry their wallet in their back pocket. How is that detrimental to the spine?
Well, it can act as a pressure or similar to a lift in a heel, or below a heel in a shoe. It can act as a pressure on the bone. Well, it's similar in that it is pressing on a bone, like the lift in a shoe would be pressing on your heel and creating an imbalance or an asymmetry from the left to right side. And so that pressure on the bone you sit on over time will lead to a stress to the spine. Now, it might not cause the subluxation, the misalignment, or any major dysfunction, but especially if you're under chiropractic care, you want to reduce those stressors so that your spine and your nervous system can start to hold the adjustment better and really benefit from the care. It's something I encourage men to take the thick, 2-inch or 1-inch wallet out of the back pocket, keep it in the front pocket, either a thin wallet or put it on their console in their car, or just, again, not sit on it and carry it in the back pocket. But it's one of those common things you see that people haven't always, maybe aren't aware of, but can be leading to a stress to their overall health.
Yeah, and I've also, along with that, and women do this too, I've seen people carry their cell phones in their back pocket too. I don't know if they sit on them in their back pocket, but that could be the same type of thing.
Yeah, absolutely. And, a general, with health, I try to find things that make it simple for people to be able to learn and then apply to many different areas of their health. So, for instance, with food, I am encouraging patients and families regularly to read labels, because if you're a really good label reader and don't just rely on the advertising of the food, you'll know what's in the food and you can make better health choices. Well, a general tip that I have for wallets in the back pocket or cell phones in the back pocket or backpacks along those same lines is think of how the stress is affecting your body, and if it's an imbalance or if it is a stress that is not ideal with the biomechanics of the body, then over time it will likely lead to loss of health and dysfunction. A good example of that is women wearing high heels. We have lots of research that shows it is contributory to degenerative hip disease, and yet it's still such commonplace to see the stress that applies and causes to the bones of the ankle, to the knee joints, to the hip joints. On a daily basis, it's really unhealthy, just like wearing and sitting on that wallet would be really unhealthy on a daily basis. Now, if you see, again, my wife and I downtown and we're eating pizza and she's in high heels, well, that's the once in a while, which is certainly acceptable. It's just knowing that that's not something you should do regularly all the time because it's not healthy.
Well, unfortunately, particularly when it comes to the high heel things, I think that's somewhat of a societal peer pressure, too.
Yeah, there are patients I work with who, when we talk about that as a change or a way they can support their care better, depending on their job, they feel the pressure to have that as their attire in their place of work. And it is, stressful and not healthy for the joints of the foot, of the ankle, and certainly affects how their spine responds to chiropractic care. So I try to encourage them to minimize or to get, footwear that's supportive. And, it's not always something they're willing to change because of that societal pressure that you're mentioning.
And what are some of the other common things that we might do on a daily basis that harm our bodies, even if we're not even realizing that we're doing it or feel it?
There are lots of little things that sometimes people are not aware of, but I think the general approach, again, to figuring or to making sure that we're eliminating the stressors we can control is to take a assessment every so often of our, and I like to do this maybe once every 2 to 3 months, to look at our diet, to have a patient kind of look over their diet, look over their sleep routine, look over their, and kind of, and do an assessment. honest assessment of, am I going to bed, really late every night? Am I eating way too many processed foods on a daily basis or weekly basis? And then you can really be honest with where those things can be improved. There are a lot of stressors that we can't control. You're not going to be able to avoid the chemicals you inhale when you walk around outside near a busy street. I mean, the fumes from the cars, the chemicals in your neighborhood from people spraying the lawn fertilizers and the weed control chemicals. You walk around the neighborhood, you inhale those fumes, and those are stressors. I mean, those all over time add up. So we can't. I don't think it's healthy to focus on the things we can't change or control readily, but rather take account for our choices when it comes to our diet, our sleep patterns, our nerve system health, our overall activity and exercise, and make sure that those areas are in order so your body is well supported, and we can improve those areas by looking at that every few months.
I know one thing you and I had talked about before, and I try to be cognizant of it, not all the time. Sometimes I do it so quick I don't even realize it, but when I'm getting into the car, try to sit down first and then swing my legs over instead of trying to all do it in one motion, because that does put torque on your back.
Yeah, and that's where a repetitive stress, just sitting in cars and at home and at desks regularly, is really unhealthy for the not only spine and nervous system, but we have plenty of research in both chiropractic arenas and also the medical field. We have lots of research that points to the loss of health to many areas of our health with long-term regular sitting, and that's something as simple as sitting. So when we can avoid those stresses like you're mentioning of bending and twisting, so by getting in and out of the car in that two-motion move, incorporating good pillows and bedding when we're sleeping, making sure there's good lumbar support when you are going to have to sit, so either in your desk chair or in your car chair. They're all ways in which we help minimize or scrub away the effect of the stress to some degree. We can avoid it altogether. I have many families who, their children are constantly looking down at cell phones or iPads and electronic devices, and that's part of our culture. We won't see that go away anytime soon. But we have to find ways to minimize the stress, because over time, that small stress adds up, and we have a danger to the health of the nervous system and to the health of the human body with repetitive micro stresses and traumas like that.
Yeah, my advice to the kids in the summertime, get off the computer and go outside and play.
Absolutely. I can't tell you how many times I've encouraged that as well. I think that they should be kicked outside and made to go outside and play outside more often. It's unhealthy to be that inactive, and certainly the challenge for a lot of parents today is that that's just part of our culture, and kids expect to have the electronic devices, but we can find ways to minimize that, similar to fast food, and to diet. Parents have a huge responsibility in how we train our children to eat and how we train them to interact with electronic devices. We're setting up the foundation for how they will probably interact with food and with their health habits for the rest of their lives. I mean, most of us eat like our parents ate, and if we were encouraged to be active when we were little, then we carry those habits on usually into our later years. Not always, but as parents, we can really make a difference in how our kids interact and learn healthy habits or bad habits. And it's up to them to just make it a point to minimize that time, to cut them off when they're on the computer or on the video game system too long, or if they've been on their phone, to give them boundaries, because if you let kids go into a candy store, they're going to eat too much candy.
Yeah.
And if you let them have the cell phone all day long, they're going to be on it too long. So you have to be a parent and make sure that there are boundaries there, because over time it can lead to a lot of health loss if it's not curtailed.
And adults are guilty of that too. I'm guilty of that. I always want my phone right near me.
We all are, John. We're all there. I agree with you. And that's where, being conscious of the things we can improve on and doing an assessment every so often. Sometimes a bad habit will start to creep in, and we're not even aware of it until we look at the pattern over a period of time. And, we can create healthy habits over time. They take a little more work, but, most people brush and floss their teeth daily, and at least with some regular occurrence. If it's not daily, hopefully they're doing it daily. And that's a healthy habit that's established over time that seems like routine to most people. So if I'm, teaching a patient to do a new stretch or to go to bed earlier or, get a little more exercise, at first it's going to be a challenge, but over time it can be a habit and a routine, just like, brushing and flossing is, where it's something they know is important and they make a priority to do it.
Yep. All right, a few more questions in the time we have left. You and I had talked about this a while back too, and I was just curious, why does fever seem to be higher in the evening than at night?
Well, that's a great question, and it relates to how our body's nervous system, in simple terms, there is kind of how our nervous system functions, and in simple terms, there is two divisions, a parasympathetic and sympathetic response within the body. Sympathetic response, or sympathetic nervous system, is what is commonly referred to as your fight or flight response, and the parasympathetic activity is your rest, digest, and heal. Now, at the end of the day, our body goes into a healing state. We do a tremendous amount of healing when we sleep, but it prepares for that when you slow down and become less active. The busyness of the day is going away, and your body recognizes, your nervous system recognizes it's an opportunity to heal. So a fever often is increasing at the end of the day because you're in that healing phase. Now, that might seem counterintuitive because a lot of people think of fever as a negative, but your body uses the core temperature and raises, your nervous system raises the core temperature in an effort to slow down the spread or the production, the reproduction really, of a viral or bacterial imbalance. And so the fever, every degree of fever that your core temperature raises, your body is using the nervous system and the immune system to heal and to restore balance quicker. So the fever is actually our friend. And the easiest way to understand that is to remember that the only thing that causes the fever is the nervous system and immune system. Now, there are a lot of reasons why the nervous system or the immune system will cause the fever, right? So there are a lot of reasons why your body will choose to raise the core temperature, and those reasons can be concerning. But the fever, unless it's at a high temperature for a sustained period, which is not as common as people might be afraid of or think is very much our friend. And when we get ready to go to sleep and we're overnight in that more relaxed state, the nervous system recognizes it's an opportunity to heal and will raise the temperature to do that healing process.
I know I can tell from myself, and I've been able to do this since I was probably a teenager, if my temperature gets up to 99, it's only 0.4, I can tell. Because I'll have I'll feel it'll. I can't really describe it on my neck. I'll feel it in my neck, and I can tell. And I can take a fever, and it'll be 99 or 99.1. Of course, as it goes up further, I definitely can tell. But it's interesting because I'm in tune. My brain is in tune with that. I know when it's happening. So
yeah, you're very aware of that change, and some people are more aware and are in tune with their body's response. There are other benefits really to the fever response that we give handouts and information in the office so patients and families can better understand why a fever, although doesn't feel good, and as a parent you don't want to see your child in discomfort or suffering, so you want them to feel better, but the fever is one of the quickest and best ways for the body to go through that healing. And we encourage support and comfort while they're going through that process. There are tips that I'll give to help comfort the child and support and monitor their progress. If it's at a high level, and I give out information so they know what to look for if it is at that high dangerous state. But in the course of my career, I've only had one incident where it was a young patient, where there was that concern concern, and they followed my recommendations, and the child was absolutely fine. They made sure to get the child hydrated well, and it's such a rare occurrence, and yet it's such a thing that people are so afraid of.
Right. Now, what do you enjoy doing when you have time for yourself?
Well, my wife tells me that she's kind of tired of hearing about both golf and chiropractic, so those are the two things that I seem to focus on the most. I love to play golf. I find it relaxing, and I find it good exercise. I walk the golf course, and I carry my bag, so it's overall probably my favorite out-of-the-office pastime. I mountain bike as well, and I love traveling, so we travel together as a family. And one of my favorite things to do is to play with the kids on the beach. So anytime we can travel, we try to be together on a beach. And I think it's the feeling of, being a big kid. I love working with kids in the office. And kids are the greatest things on the planet. Maybe you could argue puppies and kids. Those are the two.
Yeah.
So really it's being on the beach with the kids and playing golf. I actually played 3 holes of golf yesterday. 3 holes because my 2.5-year-old can walk those 3 holes, and that's about the extent of his endurance. And he loves it. He's been swinging a golf club and coming out with me, and I have dreams of following him at the Masters. Of course, I know that's just a dream, but it's still fun to think about as a dad.
Yeah, you never know. You never know. So, well, what is the most enjoyable part of being a chiropractor?
I have to say that working with the families I work with and seeing the whole family under care, when you get to see kids and parents all benefiting from getting adjusted and how their lifestyle improves often dramatically, the feedback I get from them is absolutely why I want to practice until well into my 70s, hopefully, because it's tremendous to hear how much better they're living and eating, and the experience that they're having as a family will change so dramatically when everyone is healthier, and I get to see that and be a part of that. Occasionally a family will move, and it's always a very sad moment. We had a family moving this week that I've been caring for, the little girls, 2 little girls, since they were very, very little, and now it's sad to see them go. They're part of our chiropractic family here. So that's the most enjoyable part, is working with the kids and the families and seeing how they benefit under care.
And what amazes you most about the human body?
Well, I'd have to say if you spend time studying anatomy and physiology and have any education or formal education in healthcare and don't have a deep appreciation or awe for the complexity of the human body, then I don't think that's possible, really, because it is such a complex, beautiful, amazing creation that certainly with my time in school and dissecting and studying the physical structures, but also the physiology, the way the body works in the background, it was made clear to me that I think everyone would benefit from seeing this. I think we'd stop arguing about whether there was a God. We'd just accept that, because it's such a complex system. It's not by chance or by accident that it has this beauty of creation that is absolutely amazing. The one thing that stands out to me about the way the body functions is its ability to adapt. This is going to sound kind of negative, but I'll explain. I think that the adaptation process is so powerful within the human body that even in spite of most people's efforts to abuse and not care for the body, it shines as a system of self-healing and self-regulation. And you look at how badly someone can care for themselves for such a long period of time, and the body and the nervous system find ways to somehow handle that regular level of stress and lack of support, and still function very, very well. It makes me wonder how healthy we could all be if people really took control and responsibility for their health. We would have a very different state of health in this country, that's for sure.
Yeah. All right. Well, before I go, I do want to say that, last year I've talked about this on my show before. I had surgery, and I remember the epidural had my back in extreme pain, and the one person I called was Dr. Moretti, because I knew he could give me some advice on what to do to try to ease that pain while I was in the hospital at UVA, 2 hours away. I couldn't come see you, so, but the advice, you were talking about moving around and trying different positions, and it actually helped some, but, and the thing I looked most forward to when I finally got back home was getting back to regular chiropractic care, so I get that thing healed, because even though I'm healing from the surgery, my back was killing me for like 3 or 4 weeks. And once I got back to your care, it cleared up pretty quickly. So I just want to thank you for that. And
it's absolutely a pleasure to have continue to and have had the opportunity to adjust your spine and to see your nervous system. I appreciate the compliment and the trust, but the true power and the true healing is within that nervous system, and my role is removing an interference to it. Mm-hmm. So I know that the way I'm describing that can almost sound like semantics, but when I adjust your spine, then the true healing happens, and that's out of my hands. It's to connect. Well, the way I describe it is it's a connection between your body, your nervous system, and God.
Yeah.
I'm moving the bones, but the real power is happening in those three, with that connection, those three things.
Yeah, but God's given you the ability to do that, though. So I consider you a healer through God's power.
Well, I appreciate and I'm very grateful that I get the opportunity to be a part of that with so many. I'm humbled to the fact that I'm a part of that with so many families I work with. I mean, when a mother or an adult, but especially humbling when a mom hands me an infant and says, "Here, check my child." I mean, there's a feeling that I have never taken for granted, because I know the trust involved in that as a parent. And so their little bodies and their little nervous systems respond so well to care when they need to be adjusted. They don't always need to be, but we should be checking all of them, just like we should take all kids to a dentist at some point. Yeah. And I'm grateful I got to be a part of and continue to be a part of your health, John.
Well, thank you so much. And tell folks again where they can find you online and contact you to make an appointment.
Absolutely. It's MorettiChiropractic.com, all one word, Moretti, Moretti, chiropractic.com. And that's the website. All of our info, there's pictures of us adjusting on there, and my staff and the office pictures, and you can access information about chiropractic, more about the topics we've talked about, and our phone number and email is on there as well. So I also make myself available to answer questions on the phone at no charge. If that's something someone is interested in, they can call the office and schedule a 10-minute no-charge consultation where I will talk to and answer questions on the phone with someone for 10 minutes to help them make an informed choice about their health.
Well, thank you so much. This has been so educational, and I know it has been for the folks listening as well. And God bless you, and continued success in your practice.
Thank you, John. Thank you so much.
And that will wrap up this edition of the John Baldwin Show here on Victory Radio. Thank you for listening, and join me again next Thursday evening at 9 p.m. Eastern for another edition of the John Baldwin Show. Good night.